I think it's important to really touch the contours of the quote common or the obvious ones, because even if issues are obvious, the drivers behind that are not so obvious. For people like myself who work on health systems, one of the key, the fuel for that work is to be a quote systems thinker, right? Which is to think about all the interconnected parts of systems, plural, right? That lead to these outcomes. So take your example, like why are those outcomes disparate? Right. And I think if you ask 10 people, you probably get 10 different answers, and many, if not all of those are right. And it just highlights that. So, that idea of subtlety or like less recognized, I wouldn't actually just say there's some that are clear and then we know it fully, and there's some that are subtle, we don't know them. I'd say even the ones we think we know, the drivers behind that are like less clear. And, I want to loop back a little bit to something you said about social determinants. 20 or 30 or 40 years ago, the conversation, it's evolved. It wasn't there. Even in my career, I've been able to see the evolution of that, right? The elevation of, hey, social determinants, intersections of how people might be marginalized. And I think those are really critical to when we think about these issues. So, I think, let me just say simply, there are subtle or under-recognized drivers or facets of even very obvious or flagrant inequities. That's one. And then I think, when I think about the things that are outside of that, I would say it's in that way. It's in the kind of what layer we're talking about, and then the intersections between them. I think you highlighted race, right? And race and ethnicity are incredibly important dimensions of equity or inequity, but they intersect, right? With income, education, language, lived environment, a number of different things in and outside of healthcare. And so I think if we consider the issue as there's a racial inequity, that gets us progress, but there's more. And I consider that subtle, although I think it's important. And I think that's where the conversation needs to go, right?